All right. Hello, everyone. I'm Dr. Jonathon Shook. I'm a orthopedic surgeon and sports medicine specialist at OrthoIndy. So we're going to talk a little bit today about overuse injuries, but first I'm just going to introduce myself. We'll have plenty of time to answer any questions you might have. We can go about this at our own pace. This is for you. So like I said, Dr. John Shook, I'm a sports medicine specialist and orthopedic surgeon. What that means is I did a residency or a training in orthopedic surgery. That's 5 years after medical school. From there, I did an additional year of a fellowship in sports medicine. That is a year where we concentrate specifically on treating sports injuries, both operatively and non-operatively. From that point, I came to OrthoIndy 11 years ago, and since that time, my practice has been exclusively dedicated to sports medicine and overuse injuries. So one of the things I'd like to kind of educate you about maybe is the difference between an orthopedic sports medicine doctor and a sports medicine doc. You might see a chiropractor who's introducing themselves or advertising as a sports medicine doctor. We have primary care sports medicine doctors. So everybody has a little bit different way to go about it. Important thing to know is that we are the surgeons that take care of the injuries where you have somebody who needs surgery, such as an ACL tear, a rotator cuff tear, a shoulder dislocation, those kind of things. So one of the things about overuse injuries, which we'll talk about coming up, is that there's been a large change and shift in the way that we look at these injuries. The American Academy of Orthopedic Surgeons and the American Orthopedic Sports Medicine Society for Sports Medicine came out with a campaign called the STOP campaign. And STOP stands for Sports Trauma and Overuse Prevention. If you want to go to stopsportsinjuries.org, that has a lot of good information about different types of sports injuries, and included that are the overuse injuries. So with that, looks like we have some people signing on, and we can get started with the causes of sports medicine overuse injuries. And in general, we break those down into two categories, which would be training errors or technique errors. Training, in general, what we see is too much, too fast, and too often. Everybody wants to get going. They get excited about training. They start seeing results, and it just becomes sort of an addiction to go to the gym, to go to CrossFit, to run an extra mile. And through that, your body is essentially taking on trauma. As you're exercising, you're both building up and tearing down your muscles, your bones, your joints, and you have to have a recovery time, or you kind of get behind the 8 ball. Whereas using strength training and using conditioning will actually build bone strength, but if we don't have enough recovery time, that bone strength goes down, and that's where we get stress fractures. And that's probably the most common type of thing people have heard about with overuse injuries or stress fractures. So that is when you tip the balance between too much activity and not giving yourself enough time to recover. There's other technique issues that come in there. So improper technique is a common way that we can see injuries. If you're lifting weights in a wrong way, if you're running in a wrong way, if you have some sort of wrong shoe. So if you're running in a shoe that is for somebody who pronates or rotates their foot inward versus somebody who rotates their foot outward, you're going to put different stresses across the joint and the leg, and that's going to cause potential injuries to the bone, muscles, and tendons. The ligaments and tendons are stretchy and flexible type structures. So over time, you actually build a flexibility and you build a strength to those tendons. So going about it very fast and not giving yourself a chance to recover, that will cause a potential risk of injury to that. So a couple questions coming in, and we'll definitely get to those. Somebody asking about the age of the person training, does that make a difference? And certainly that's something that does make a difference, whether kids are more prone than adults. I think we do need to understand kids are not just small adults, and there are differences in the way that they need to train and exercise too. Some of the risk factors, if we continue with that, certainly age, the very young athlete, their joints are not developed. They have growth plates. They're at risk for these certain injuries to the growth plate that could actually be something that is a permanent problem. So we certainly want to make sure that with younger kids that are training for sports, that we don't overdo it, because that can have some really long-term repercussions. In at the very other spectrum, aging adults, bone mass and strength becomes weaker, so you're at higher risk for stress fractures or stress-related injuries. So maybe that you need a little extra time in between your workouts. Maybe you should be taking some supplements, some vitamin D or calcium to help strengthen those bones. And certainly it's never a bad idea to see your doctor to find out what are some precautions I should take before I start exercising, or what if I start experiencing this, what should I do? Another risk factor would be if you've had a prior stress-related injury. So if I've had a prior stress fracture in my tibia or my shin, then I'm at a higher risk of having another stress fracture, whether that's on the same side or the opposite side. But you're certainly at a higher risk for that. So there are some things that make you at higher risk. There are some genetic factors. There are differences between males and females there. And so those are, again, things to look at and things to think of. And again, always a good chance to go see your doctor if you're experiencing any of that. Inexperience in general is a risk factor. So if you are brand new to CrossFit and the first day you go in there and you do a complete workout, follow everybody else, the odds are you're not only going to be sore the next day, you potentially are going to injure yourself and not going to be able to continue to do that. So, go into it with the thought of I'm going to learn something and then I'm going to work up to it. Just like you wouldn't expect to come off the couch and go run a marathon, you shouldn't expect to go into a CrossFit type environment and be able to do everything on the first day. Biggest thing we want to also do, make sure we're warming up and cooling down. Stretching is very important. If our joints aren't flexible, higher risk of injury for sure. So things to avoid. If you're a runner, we should probably think about replacing our shoes every 250 to 500 miles. Sounds like a lot when you think about it, but it's really not once you start adding this up. If you're running 3 miles a day, a few days a week, it doesn't take long before those shoes are worn out. And if you continue to wear those old shoes, you're at risk for stress injuries to your feet and to your legs. The other thing we've talked about before is making sure we're pacing ourselves. Everyone wants to see those results, so they push and oftentimes that puts you in a predicament where you're seeing a lot of good results initially, but then you have to really back off because you're having injuries, and that isn't going to do you any good in the long run because you're going to be constantly yo-yoing back and forth to get these gains, and then you're going to lose them as you have to back off. So really, it's like setting up a budget. You want to set up your workout so that you can maintain this throughout the entire season versus trying to really just go really hard and cause some problems. So somebody's asking here, this is a good question here about 5-year-old grandson works out at the Ninja Gym. They have ropes and climbing walls. It says, as long as there isn't any pain, is this safe to do? I've seen these ninja classes are pretty cool. My son, he actually did that and he really enjoyed it. I think, yeah, anytime kids are active these days is great, right? To peel them off of an iPad or off the TV is pretty tough. So if we can get them active, let's do that. Yes, certainly climbing up a rope or up a wall, there's risk of falls and injury that way. But I think all of those activities where you're using different muscles and you're learning coordination, those are all fine. We just need to make sure they're in a supervised environment and we're giving them some teaching, some training before we just let them loose and do those things. There's certainly opportunity for injury there, but I think that's in general a good thing. Another question talks about why icing over heat compresses, I believe. I tell my patients all the time, if you ice, you can never go wrong. Adding heat to something is sometimes not a good idea. If you have swelling of a joint, if you put heat on that joint, you're going to encourage more blood flow. As you encourage more blood flow in there, you might actually get more swelling and more pain. With ice, you're going to basically discourage that swelling and you're going to decrease the inflammatory factors in there. You're going to decrease the swelling, which in general decreases your pain. So after injuries, after surgeries, ice is always the right answer. So you never want to let the ice touch your skin directly. You should always put a barrier such as a towel. 15 to 20 minutes at a time is the general rule. Take it off. Wait that rest of the hour, the next 40 minutes, and you can do that again. You can continue to reapply that pretty consistently as long as you take breaks and ice in between. We've talked a lot about CrossFit and cross training, and those are really good exercises actually to do different types of exercises that move your body in different ways. It actually helps prevent injuries. We see younger kids that are specializing in single sports. And when you specialize early in a single sport, it's been proven that you're at higher risk for overuse injuries. So we discourage 13-year-olds from choosing, I'm going to be a baseball player and I'm going to drop out of track, I'm going to drop out of basketball and just play baseball. In fact, a majority of Division I football coaches, when interviewed, said, I would take a multi-sport athlete any day over one that has decided to specialize early in just football. So that should tell you something. There's Pam Neal. She's in our office. She's logged in. So thanks for joining us, Pam. Let's see. I'm going to piggyback a little on that icing question. In here we talk about recovery. So there is a need for recovery. Stretching again is important. Cooling, cool downs, warm ups, cutting back on activities. Those again, that opportunity for your body to bounce back and to recover. You have to have it. If you keep on continuously straining things, you're going to certainly run into overuse injuries. And the old adage, everybody's probably heard, no pain, no gain. That went away a long time ago. That was something that went away in the 80s, and we no longer encourage that at all. So if you're having pain, we say stop. So just remember, the no pain, no gain is not something that we like to see anymore. So we have a couple of other questions that were sent in previously before this event. We had somebody asking, their daughter plays tennis. She's been playing tennis a very long time. She is building muscle. talks about how she has a little bump on the side of her body, and that the mother, I think, was thinking this might be a muscle building because of all these years playing tennis. And that's certainly something we see. If you're lifting weights, you're going to see gains in muscle mass. That's why you're doing it. In this situation, I'm thinking, and again, I've never evaluated this patient, and I think I would encourage them to see a physician. But talking about a large bump that's on one side, this might not be muscle hypertrophy or strengthening. It could be scoliosis. It could be something else that's not necessarily muscle. So in this instance, this is certainly something I can't diagnose over Facebook Live. I think you should see, start out with your pediatrician and see if they think this is something that you should come see an orthopedic doctor. And there are spine specialists and pediatric specialists that would be best to handle this. Another question was, what are the most common soccer injuries? Probably the most common things are just bumps and bruises, a lot of falls, a lot of kicks to the shin, a lot of shoving going on. That happens. Twisted ankles, torn ligaments and injuries to the knee, ACL tears. That's the key big word we hear these days. And I see lots and lots of ACL tears in soccer athletes, particularly younger female athletes. With the women just winning World Cup, there's a lot of emphasis now on and women playing soccer, and that's great. We do have to realize there are high risks to that sport. In fact, probably out of all the sports, short of football, women's soccer is probably one of the highest up there as far as risk of ACL injuries. Is it better to keep moving if you have arthritic joints? Yes. I say yes. That moving versus should I run? Should I do this? Should I do that? But always move the joint. In general, unless there's a fracture or broken bone, movement of the joint is always helpful. And in fact, motion of the joint is something that helps us heal joints. So I would certainly encourage somebody with arthritic joints to move. Low impact activities, some weight training. It doesn't have to be strenuous or high impact, but movement of the joint is very important. Let's see. Oh, this is a good one. This kind of brings me back to high school football. So are two-a-day practices safe? Are they safe? Probably. Are they fun? Absolutely not. Yeah, so two-a-days, they always happen to be in August when it was 100 degrees outside and you were sweating like crazy. So I think probably one of the biggest risks of these two-a-days is hydration and overheating and exertion type injuries. We actually, even back when I was in high school playing football, we had weigh-ins and weigh-outs. So if we lost a certain amount of weight, from sweating, we couldn't go back to play until we put that back on with water. We were lucky enough that we had an athletic trainer that was there all the time. So they monitored everybody. They made sure that you were getting enough hydration, making sure you weren't having any overheating type issues. But yeah, in general, they're safe. I would say nowadays, again, with all the emphasis on concussions and other types of injuries, we recognize these injuries a lot sooner, and we don't just say, oh, that's just a bump, or go back in there and no big deal, keep going. So in general, I'd say they're safe. Another question says, my shoulder hurts when I run. Is this normal? I don't know. I mean, I don't think a shoulder pain while running is something I would call normal. Now, particularly if it's your left shoulder. If it's your left shoulder, that could be cardiac related or heart related. Shoulder pain that radiates down your arm is an indicator of heart problems. So certainly if it's the left shoulder, I'd say no, this is not normal. You should definitely get that checked out. More than likely, this pain might be from the neck. It might be from jarring of the shoulder, but I would say it's certainly not normal. I would have that looked at. So, all right. So waiting to see if there's any other questions. We're happy to take any more. Otherwise, thanks for joining us. You can follow us, OrthoIndy, on social media, Facebook, Instagram, Twitter. If you're interested in making an appointment with me or any of our other physicians, there's a link you can click on, or you can call us at 317-575-2700. So thanks for joining us, and have a good night.